our mission is your mission is our mission. We care for the poor and vulnerable, and
Absolutely.
that's why this partnership works so well.
It really is, and I can't thank you enough for seeing the value in the Arukah Respite Center,
Absolutely.
and we've had many opportunities. In fact, I've been sharing one that is just like the gold star standard of what we're trying to accomplish. You may not be familiar with this one, but about a year or so ago, we had a gentleman come to us. I've been calling him Mr. Jones,
Mm-hmm.
and your team asked for 30 days, and we're like, okay. But while we were taking care of Mr. Jones, and we realized that he had none of his life documents, so he didn't have his Social Security,
Oh,
his
wow.
birth certificate, an ID. So we got all those reinstated and reissued. We also found out that he was eligible for Medicaid and Medicare. We got him signed up for that. And then we were able to also find him a placement in an assisted living facility over in Santa Rosa County,
Wow.
over in Pace. And so, I mean, that is the textbook situation that we want. They're in the hospital after having an acute care situation.
Mm-hmm.
I believe he had a heart issue. Came to us. While we had him on our care, we were able to identify what his next steps needed to be. And then we were very fortunate to find him a placement in a very close to his wheelhouse of support that he had in Pace, Florida. And so, I mean, just the transition from going into the hospital, having an issue, recovering in the hospital, then coming to here and recovering at Arukah, and then getting into the next step over the assisted living facility is just the perfect scenario for everybody. Does that happen for everybody? No, but we've had very great success stories. We had a young lady that we reconnected to her family in Texas through Drayton Smith and his organization and the county's Project Reconnect. So, you know, each person's journey to from the hospital to Arukah is unique, and it's during that time that we're really trying to change the perspective of their journey forward, but also just to kind of eliminate that cycle of bad healthcare
Absolutely.
outcomes. Because I'm sure you can attest to the fact that most of our homeless population use your ED as their primary care. Can you speak to that for just a brief moment?
Yeah, I mean, it's, our mission at Sacred Heart is to care for anyone who walks through our door. It doesn't matter your ability to pay. And you're right, we do see a lot of homelessness. We see, maybe they want moral support. Maybe they need a hot meal. Maybe they
Sure.
need a hot shower. There's no telling why they come to us. But when you came and met with me, it's probably been, 12, 18 months ago, talking
Yeah.
about the respite center, it was a no-brainer.
Yeah.
Because the last thing we want to do is transition any of our patients outside of the hospital without the right tools to make sure they don't have to come back to us for that same
Absolutely.
episode. So what the respite center is able to do for our patients, for the community's patients, making sure they have that step down level of care to where they can get on the road of healing and hope. It just made sense to partner with you guys. Yeah, I mean, that's a big barrier we have at the hospital too, is just allowing people to be vulnerable enough to tell us what they need, right? There's a lot of pride in everyone.
Oh,
And,
absolutely.
being a part of the Catholic Church, being a ministry of the Catholic Church, we believe everybody is made in the image and likeness of God, just like you guys do here.
Absolutely.
And everybody deserves the same chance, the same humility, the same resources to get them back on their feet. And
Couldn't agree more.
what the respite center is able to do in the care journey is exactly that. And what I've been most impressed with Waterfront is when you sat down with me in our boardroom and said, "Will, this is what we want to do." Everything you said, you've lived up to your word. It's a first-class facility, great quality of care, making sure that anyone who walks through your doors is getting that same level of care when we discharge them from the hospital.
Well, I appreciate you saying that. The team that we have in place, our chaplains and our support personnel that help our Arukah program managers do those things. They're truly the unsung heroes of this whole program. And it is just so that we can break those bad cycles of healthcare outcomes and bad decisions, because that's just no way to live.
Right.
It's so I've been referring to it as a win-win-win situation. It's a win for you as a healthcare provider. It's a win for the patient because now they're not still on that merry-go-round of bad outcomes.
Right.
And then it's a win for us. We get to support our ministry in a bigger way. You get to utilize your resources in a much more efficient way,
Yeah.
and then the patient is better for it. So
Right.
I mean, it truly is a win-win-win situation, and with everybody winning, nobody can lose.
Totally agree.
And as long as we just stay connected and continue to communicate like my team does and your team does, we'll be able to tackle any issue that comes our way.
Yeah, I totally agree.
So
The staffing, what does it look like from a clinical perspective at the respite center? How
So-
many beds?
Oh,
Who's
okay.
caring for them, et cetera?
Well, so that's part of the genius of the program. We're not clinicians, so we have a program manager that helps coordinate services and make sure that those discharge plans are followed to the T. But we do not provide any clinical care.
Right.
That's not our wheelhouse. But our MOU allows you to send in home health care.
Yep.
And we constantly talk. We will help get them to follow, preventable appointments, like with wound care and things of that nature.
Rehab,
Whatever they need. If they need to be walking around the mission, those kind of things. So that's what the true thing. So we have one program manager, but both missions support the operations of the Arukah, because the one program manager can't be in all places at all times.
Right.
And so we rely heavily on our ministry teams at both locations to supplement our Arukah staff.
Great. So what can the healthcare community, health systems, urgent cares, private practice offices, what can we do better for Waterfront? How can we better support you guys?
Well, I mean, just the opportunity of those individuals that would maybe qualify to come to our healthcare facility, and if someone presents and they're in a homeless situation, they might be a candidate. I would just ask that they reach out ahead of time, and we can get all the P's and Q's out of the way, and that way, if they are getting discharged from an urgent care or even the ED or a hospital stay, that all the formality stuff is taken care of. So there's a clean transition and continuum of care from your health system to our facility here. And then we get all the information we need to help take care of him for you guys.
Yeah. And I can assure you, I mean, I talk to our case managers all the time. It is a seamless process. I mean, this isn't a burden on your system or your office. Waterfront takes the brunt of it. They run with it. They make sure they have everything they need to get these patients into the respite center. So I highly recommend learning more if you don't know about what they're doing here at Waterfront, the respite center.
Absolutely.
Yeah.